Hey everyone, hope you're doing really well. Welcome back to my channel. Thanks for joining me. My name is RMT Randy. I am a registered massage therapist in Alberta, Canada. And today I want to talk about how do we flush and drain tension after we're doing some self-massage. So I'm going to talk about a few areas of the body, the jaw, the shoulder up here, and the hips. So if you have jaw issues, if your jaw gets tight, if you end up doing any kind of self-massage, maybe you get headaches, do whatever you like, do whatever feels nice. But what I would like you to do, what I recommend my clientele to do, is to flush and drain everything back into the torso when we're all done. Heart is really efficient at getting blood away from the heart. That's its whole job. It pumps blood away, oxygenated blood away. Not so efficient at returning fluids back to the torso to be metabolized through the kidney and the liver, and all the things that filter the blood and clean it. So you want to operate really lightly. We don't want to push really hard because then we're just going to push the fluid and the tension out of the way and be working in the muscle. And this is the technique when we're done working with the muscle, when we're done with our self-massage, whatever that is. So we can do a test here. Take one side and just drain, scrape, lightly guide fluid or tension to the jawbone. And then on the other side, pull it past this bone, past that baton, past that relay. And just see if you can notice a difference in having a little pocket of tension in the jaw. For the side where you're actually going past the jawbone, I immediately notice a difference. It just makes it go away. And then you can follow up with the other side and see if it resolves the pocket of tension that was there. For extra brownie points, or like for extra gold star, to do even more, you're going to take all the way past the collarbone. So we don't want to put all this tension that was up in the jaw, we don't want to leave it in the neck. So really lightly following the contours of your face so you can feel the bones. We're going to go past the jawbone and then past the collarbone. And that's all you need to do. For our shoulder, I want to look at the supraspinatus, which is this triangular muscle up here. This muscle raises the arm up to the side. And so you can feel around for like a ridgy bone. This is the spine of the scapula. This is one edge of the muscle. The muscle doesn't go past here. And it doesn't go really past this top edge of the shoulder either. So you can keep going to the collarbone if you like, but we don't need to. So how you can self-massage this muscle, it bugs most people, is you're just gonna gently rest your fingertips on the tissue and let them relax into the tissue. You're not going to push. Once it's as relaxed and they're as deep as they can be in the relaxed tissue, you're just going to start to noodle around a little bit. You can do really small X or plus motions, or you can do wider motions, whatever feels good. You can also torque this area where you grab the tissue in a really light pinch and you lift up the tissue away from the body, and you can give it a nice little twist. So how a muscle activates is we have muscle fibers and then they contract and then they relax, but sometimes not all the fibers relax. So by doing a torque and twisting everything up, we're giving everything time to like untangle and then they can relax again. But as I said, body's not really good at moving fluids around except for moving fluids away from the heart. And so we might have some tension left in here and we want to get it out of this area. We want to put it back down more into the torso if we can. And really you can just consider the body kind of like a relay race. You want to take any tension from like bone A past bone B. So here we are, we're in the muscle, we've done our massage, and now we want to flush it. Just gently rub past that ridgy bone that's back here. Just get it out of there. If you want, you can go from the bone to the front to the collarbone and drop it down. But again, we just don't want to leave the tension here in this muscle. Finally, we can move on to the hip. So both the outside of the hip and the inside crease here, if you've got anything going on the inside thigh or right here in the inguinal line of the groin, this can be a really awkward area for anyone to massage, including ourselves, because the hands get so sore and so tired. So what I like to do is starting below the knee, because a lot of these inner leg muscles end around the knee. So I like to get down and with the bone of my arm against the leg here, kind of scrape up through the leg and then pull up through the pelvis into the abdomen. Don't end at the leg and just drop it near the hip bone and leave it. We want to go past our knobby hip bones up into the low belly. So you can just do that a few times. I might put a twist in my arm as well, just to, I don't know, feel fancy and get some more traction. And you're just going to pull it up. And you can do the other leg. Sorry about my noisy floor. And then for the side of the hip, we can do the same thing. Maybe this side of the hip area tends to really bother you. So you can take the heel of your palm and just scrape up past the bone. So here's the ridge of your hip. It's called the iliac crest. We don't want to stop before we pass this bone. So you might have to go up past the curve of your hip and into the indent of the waist. But that should start feeling really good. Okay. I hope that helps.